We're looking at in this project an assessment of exposure to arsenic from private water supplies in southwest England. There are several partners involved in the project. The Health Protection Agency, who shortly will be Public Health England, the British Geological Survey, and ourselves, the University of Manchester. And in particular, we're based here in the School of Earth, Atmospheric and Environmental Sciences. The project's needed because arsenic in private water supplies has been identified as quite a significant health problem in many parts of the world. The countries most impacted by this are in Asia, in particular Bangladesh. Within the UK, the problem is likely to be far, far less serious than it is in Bangladesh, but nevertheless there might be an appreciable risk to human health.
Well, concentrations of arsenic in drinking water alone aren't enough for us to accurately establish the human health risk. So what we need to do is get biological samples. So when arsenic enters the human body, in the short term it's excreted in the urine, and in the long term it's stored in tissues such as hair and nails. So we're asking people to provide a sample of hair, fingernails and toenails, and also a urine sample. Appointments will be made at a time which is most convenient to the participants. They will have a home visit from the health protection practitioners.
Yeah, 10 minutes, that's brilliant. Yeah, I'll see you then. Cheers, bye.
We'll be asking participants to complete a short exposure questionnaire where we'll be collecting basic information such as dietary habits as well as day-to-day activities to try and assess their exposure to arsenic. Okay, Al, how many times a week do you typically eat rice?
About once a week.
Once a week,
Yep.
okay. When you do, what is the typical size of the portion? At the end of the visit, we'll be collecting the samples from the participants. So they'll have collected their own urine that morning and they'll have been given the choice whether to have the nails taken from them or collect their own samples. We'll also be collecting a hair sample from the back of the neck and a small sample of rice from the kitchen if convenient. So that's all the information we need today. Do you have the samples to hand?
I do, yeah. I've got the nail samples here. And I'll go and get the urine samples, they're just out in the fridge.
Okay, thanks very much. We consider this project to be completely non-invasive and it's no more dangerous than day-to-day activities such as cutting your toenails, fingernails or just going to the hairdressers.
Once we receive the samples into the geochemistry lab, which is a restricted access lab, all the samples are catalogued, known quantities of the samples are taken and they are dissolved in varying concentrations of acids, and blanks are kept to a minimum because we're expecting low levels, and because of this then the sample solutions are analysed by ICPMS in our Class 1000 clean rooms. We've got over 20 years of experience analysing these types of samples and we've got an extensive publication record. We also in this laboratory have to comply with a lot of health and safety regulations, and more recently we've achieved a Gold Award for sustainability.
In line with the regulations of the Data Protection Act and the Caldecott guidelines, each sample that's given to us by the participants is given a unique code which makes it non-identifiable to the researchers. And this also means that once the data is published, this is completely anonymous. The overall aim of this project is public health protection. In order to do that, we need the help of the public themselves. So we're really encouraging people to come forward and volunteer for this study because it really is breaking new ground.